You've probably seen an IV bag 100 times, right? Just a simple bag of clear fluid. But inside, there's some really fascinating and powerful science going on, especially when it's filled with what's called a hypotonic fluid. Let's dive in.
So let me just start with a kind of weird question. What if the whole point of an IV fluid was to do something that sounds a little, well, alarming? What if it was designed to intentionally make your body's cells swell up like tiny water balloons? It sounds wild, I know, but that's exactly what we're talking about, and we're about to find out why.
To get our heads around this, we've got to break down the word itself. Hypotonic. You know, that little prefix hypo just means lower, and that one little word is the key to this whole thing.
So, a hypotonic solution is defined by one simple thing. It has a lower concentration of dissolved particles, stuff like salt and sugar, which we call solutes, than your own blood has. It's all about that comparison. So just picture it. On one side, you have the IV fluid, which is pretty diluted. On the other side, you've got your bloodstream, which is comparatively packed with solutes. And whenever nature sees an imbalance like this, it's going to try and fix it. And that kicks off a fundamental process called osmosis. It's a basic rule of physics. Water will always move from an area of low concentration to an area of high concentration to try and even things out. So in this case, water leaves the bloodstream, that's the intravascular space, and it rushes into the body cells, or the intracellular space.
And boom, that's the entire goal right there. The main effect is cellular hydration. This fluid isn't just rehydrating your bloodstream, it is specifically designed to get water inside your cells, the ones that are absolutely parched. We're talking rehydration from the inside out.
So, we get the science now, but what do these solutions actually look like in a hospital? Let's take a look at the most common types of hypotonic fluids that are used every single day.
All right, here are the main players. You'll see different strengths of sodium chloride, but the one you'll see most often, by far, is 0.45% sodium chloride, which everyone just calls half normal saline, or half NS for short. You'll also see dextrose solutions, which use a type of sugar instead of salt to do the job.
Okay, so we've got these special fluids that are designed to push water into cells. Now for the really crucial question, when on earth would a doctor actually want to do that?
Well, they're used for some very specific conditions. The most obvious one is to treat cellular dehydration, when the cells themselves are just dried out. It's also used for something called hypernatremia. That's just a fancy term for when you have way too much sodium in your blood. And you might see it in some specific cases of dehydration related to diabetes. In every one of these situations, the problem isn't just a lack of water, it's that the water isn't where it needs to be.
Now, this is where our story takes a really important turn. The ability to make your cells swell up is a powerful medical tool. But like any powerful tool, it comes with some pretty significant risks if it's not used exactly right.
So what's the catch? Why is this targeted hydration method something that clinicians have to be so incredibly careful with? What's the potential downside of forcing water into your cells?
Well, the very same mechanism that helps can also cause some serious harm. If you push too much water into cells, you can cause dangerous swelling. In the brain, that's called cerebral edema, and it increases the pressure inside the skull, which is really bad news. At the same time, by pulling so much water out of the bloodstream, you can actually cause low blood volume, or hypovolemia, which is a whole other kind of emergency.
And this is exactly why hypotonic fluids have to be used with extreme caution or just avoided completely in patients who are already vulnerable to these risks. I'm talking about people with a head injury or a stroke where any brain swelling could be catastrophic, or in patients with heart failure who just can't handle those big shifts in blood volume.
All right, we've covered the science, the uses, and the really serious warnings. So to make sure all of this sticks, let's just boil it down into one simple, powerful takeaway.
If you remember just one thing, make it this sentence. Hypotonic means low solute. Because of that, water moves into the cells, and as a result, the cells swell. This single chain of events explains everything, both the good and the bad.
So, as we've seen, that simple bag of saline isn't so simple after all, is it? It's a precision tool designed to manipulate one of the most fundamental processes in our bodies. Now that you know the science, how does it change the way you see it?